Terrific. Thank you so much, Catherine, and welcome everyone. Welcome to Washington Women's Foundation Priority 101 series on youth mental health. My name, if you don't already know, is Maria Colby Wolf. I'm the president and CEO here at the Washington Women's Foundation. Um, Before I go any further today, I want to take a moment to recognize that we are living in strange times here in the United States. Much of what has been taking place over the last few weeks has been confusing, troubling, even frightening for many of the people we center at our foundation. Our commitment to racial and gender equity is longstanding. And for those of us committed, and we are committed to the values of equity, diversity, and inclusion, for those of us committed, and we are committed to human rights and active inclusion and active compassion for all people, both in our state and across our world. These are trying times indeed. We will be talking today about mental health for young people. And I want to tell you now that yesterday I signed off early from work, sharing with my staff and now with you that I took a few hours off for my own mental health. I had hit a wall, wrestling with the implications of these national matters on our local nonprofits and the people they serve. So before we go on today to discuss youth mental health, I want to make space for all of the grown-ups in this room that as we look to these ways of shoring up our children and our young people's health, we also need to be shoring up our own. So thank you for being here today, for taking time out of this to think about these issues. We really do appreciate your time and your energy. Okay, I acknowledge today that we are gathered here on a stolen land, on unceded indigenous homeland in the context of broken treaties and unresolved harms to Native peoples. We are on the traditional land here in Seattle of the first people of Seattle, the Duwamish people, and of the Coast Salish, the Stillaguamish, the Duwamish, the Muckleshoot, and the Suquamish, who have made and continue to make their homes here around the Salish Sea. We recognize as well that we live in a nation of wealth, a wealth created by the subjugation and exploitation of African peoples, brought to this land through chattel slavery. We honor and uplift the original indigenous stewards of this land and the forced contributions from generations of Africans. This is an acknowledgement of stolen land and stolen labor and a recognition that the impact of these wrongs reverberates into our present day. And furthermore, that much of the work that we do at this foundation is about righting the repercussions of those wrongs. Our acknowledgement is not the work. It serves only as a first small step in honoring with gratitude this land on which we live. The Washington Women's Foundation is a strong and inclusive collective of informed women who together impact community transformation through trust-based philanthropy and education. We value and encourage active learning, thoughtfulness, and uplifting the voices of those in our region who are experts and leaders in their fields and in their own lives. Through our collective grants, our members learn and invest in 3 different priority areas each year that have been identified by the broader Washington Women's Foundation community and chosen from among the year's themes. This year, our theme of healthcare is prioritizing a focus on youth mental health. So in 2025, the Washington Women's Foundation will invest in culturally relevant mental health and connection building services for young people, ages 26 and younger, including organizations with counseling staff or working with networks of external providers. We are interested in learning more about systems of mental health care and how young people interact and heal within these systems, including systems that are designed to address youth addiction recovery. We have some excellent speakers for you today. They are experts, change makers, leaders in the mental health field across Washington state. And at the end, we will have time for engagement and questions from the audience for these panelists. I thank you again for being here, for caring about your community. And now I'd like to hand the microphone off to my colleague, Catherine, who will be our moderator today.
Thank you so much, Maria. It's great to be together. Like Maria was saying, it's a strange time, and I find so much comfort in being in community and learning together and seeking our shared humanity. So, thank you so much for being here, and I'm thrilled to introduce our speakers today. I'm going to have you guys join me up on the big screen. And Catherine, I wonder if you would like to start. If you could introduce yourself, share who you are, uh, what is the work that you do, and maybe where you're located.
All right, well, I'm honored to be part of this today. Thank you for inviting me. I work as a peer specialist and a therapist in the Medical Lake School District. That's near Spokane, small district, just a little bit to the west of Spokane. The peer specialist position I'm working is part of a 1-year DOH grant-based position. It's within the district, and the purpose is to support youth, family, community mental health, and it's primarily through suicide and substance use education, prevention, and then support. So I also work in the district, so my other half is as a therapist, and that is providing counseling services within the school setting to students as well as to community members. Medical Lake has a really unique program where they offer multi-tiered mental health services to students, family, staff, and community members. Did I answer all your questions?
Thank you, Catherine. Yes, we are so glad that you're here and appreciate the work that you do. Gina, I wonder if you could share who you are, what is the work that you do, and yeah, welcome.
Yeah, thank you for having me. I'm Gina Capidu. I use she, her pronouns, and I get to be one of the program coordinators for Kids Mental Health Pierce County. Expanding the model of Kids Mental Health Pierce County statewide is Kids Mental Health Washington. We intentionally use the words of model expansion, not replication, because we know that every community around the state has different needs. There's different cultures. How you administer services in a rural area versus an urban area is going to be different. Our populations, our peoples are different, our geographical location. So I get to work with 10 teams around Washington State that are rolling out this model to make it their own locally in partnership with Healthcare Authority and Developmental Disabilities Administration. So really, we look at serving kindergarten through 12th grade youth, and I'll expand a little bit more a little bit later. But thank you for having me.
Thank you so much, Gina. We're glad you're here. And Alexis, welcome. Please introduce yourself.
Yeah, thank you so much for having me. My name is Alexis Bates. I'm an adolescent health consultant at the Department of Health, and I work in our adolescent and young adult health unit in the Prevention and Community Health Division. And I've been here at DOH for almost 9 years. And my role is really to coordinate or co-coordinate our Youth Advisory Council to talk to them about different public health topics to make sure what we're doing is relevant. And from that, we collaborate with the Youth Advisory Council to implement their recommendations and do things like Teen Health Hub Washington and some other upcoming projects. So I certainly don't consider myself an expert in all of these things, but I think our young people are an expert in their world. And so I'm hoping to do my best to share with you what they've shared with me.
Thank you so much, Alexis. We're glad you're here. And our first question is a definition question. We're interested in learning how you define youth mental health in your context and in your work. And maybe just really tangibly, if you could share what your program looks like, who it touches, and anything else that you think we need to know. And Gina, I'd love to go to you first.
Yeah, absolutely. Thank you so much. So I think for us, when we think about the definition, it's a really intentionally broad piece for us. So we serve the entire care continuum. So that's everything through prevention, through crisis and crisis stabilization and post-crisis. For us, we really serve kindergarten through 12th grade youth, so school-aged youth, but we do serve kids as early as birth all the way up through 21 is what our teams around the state have seen. I think what's really unique about Kids Mental Health Washington is that we serve any youth with any insurance background of any acuity. So we serve that entire care continuum, and we do it through a couple of key pieces, and I'll drop our information in the chat. But the first one is we provide behavioral health navigation. So whether it's getting connected to equine therapy, traditional talk therapy, maybe it's a wilderness grief, we believe that mental health is holistic. And so it's going to take clinical and non-clinical recommendations. And I say that as a trained social worker. I think the other thing that we offer is sometimes cases are really complex and you need a lot of systems coordination. So we provide multidisciplinary teams. So we have community volunteers that come from Department of Children, Youth and Families, Developmental Disabilities Administration, hospitals, Peer Voice, community-based mental health, and everybody comes to the table with the youth and or their caregivers and say, what have you tried? What do you need? What does mental wellness look like to you? We make some recommendations from that team with the family, and then our teams help implement those recommendations and make sure that those relationships and connections happen. And then we've got steering committees that are made of all various different stakeholders that serve a community to say in collaboration, what do we want our community initiatives to look like? Whether that's a crisis roadmap, whether it's going to be increasing school-based trainings, whatever that looks like looks different across the state. And last but not least, we have a website that every region runs locally. So there's 10 of them across the state under the umbrella of Kids Mental Health Washington that's got up-to-date resources on mental health stuff. Because what we hear from families is they don't need another door to an empty room. So having a current hub of resources of local providers is really critical for us. Thanks, Catherine.
Yeah, thanks, Gina. Wow, it's you guys seem like you do so much. So excited to learn more. Alexis, why don't we move to you?
Yeah, so we in adolescent health, our focus is on young people ages from about 10 to 11 to 24. So that is where we direct our attention. But I work in a bigger unit called Thriving Children and Youth, which includes K through 12 and then adolescent health as well. We think about mental health really holistically because it impacts so many different things. It impacts well-being of young people in their relationships with their friends and their development and how well they do at school and different health outcomes. So we recognize that mental health is healthcare. And so a lot of our work is about making sure young people have access to not only to healthcare, but to youth-friendly healthcare. So there's a couple of ways that we are working on that. We currently operate and fund 17 school-based health center grants around the state to support school-based health centers. So that way young people are able to access care in places that are convenient to them. And we use that as a strategy to also address a lot of the common barriers to healthcare, like transportation and cost. Most school-based health centers see young people for no cost or low cost. And then most school-based health centers are providing comprehensive medical and behavioral health care. So they're providing primary care services, but also they're providing some level of behavioral health care. We also support different types of behavioral health care that similar to what Catherine's project is, that is a little different from our school-based health center, but is still school-based. Young people have told us that they want to see more behavioral health care services in the school setting. So it's a priority for us to get more care in school settings. So our peer support service grants is one way for us to do that. And then we also are doing work to just make sure care is youth friendly. And so we define youth friendly as being age appropriate, culturally responsive to young people's needs, and care that's like compassionate and inclusive and non-judgmental. So young people feel safe getting the care that they need. So the way we do that is we work on improving confidentiality processes at the systems level, working with providers and young people to know their rights and to know what is confidential and what isn't. So that way it's really clear to them what they when they're going in to see a provider. We work with providers on technical assistance around confidentiality and youth-friendly care. We have Teen Health Hub Washington to make sure young people have access to health information. And because we as the experts know where all the resources are, like Kids Mental Health Washington, we make sure to include those really credible, high quality, reliable resources on our website. So that way it's easy for young people to find. I feel like I'm going to stop there. I feel like that was quite a bit.
Thank you, Alexis. Yeah, it seems a common theme is that there are lots of resources out there. So it's sweet to see, this knowledge is power. And so connecting communities with these resources that you guys are working so hard on is exciting. And Catherine, what about you? If you could describe your program.
Well, both Gina and Alexis hit on a number of things that touch ours as well. And there are resources available. I think Gina mentioned that about how it's just different from different communities and different needs in different districts. So I think one of the big things for us being in a somewhat rural area outside of a city is access. There's resources, but the access is difficult. So I'm going to back up. Supposed to ask the big question first was defining youth mental health. So our definition, youth mental health is really the emotional and psychological well-being of every young person, how they cope, build relationships, and navigate those challenges. And the challenges are broad and different places, different kids, but some of those include, and some that we see a lot, is the anxiety, depression, substance use, and those things really affect their overall development and functioning, from whether it's them that are having those issues, or taking that out to more of a family system where the families might be having some of those challenges, which are then affecting the kids. So it might not be the kids specifically, but we're trying to take a big community view of it as well. Let's see, our program, what are we doing? We have me, I'm the peer specialist here, and then we have interns, and we also partner with another organization that supplies therapists, so we can have multi-leveled support. So as a peer specialist, I'm going in, meeting kids, connecting with kids, talking to kids, having groups. Then I'm also doing that in the community, connecting with community members about, specifically in the peer specialist role, a lot of that is connection, substance use concerns, as well as prevention and self-harm and suicide. So I'm doing classes, I'm doing weekly groups, both in the schools and offering those to community members. And then how we also support, we have QR codes. The kids can literally request mental health services, trying to make it as accessible as possible. And the way we financially are supporting that is we have a director over all of our health and wellness services. That's Tony Barlow. She was invited and was not able to be here today. And she also oversees all of the mental health, and she supervises and oversees interns. So we have clinical mental health and marriage and family interns that come, and then under supervision, those are the people that are building those connections and connecting with students and providing weekly mental health services. The kids don't have to be transported somewhere else or driven to Spokane, which is a good 30 minutes away. We're trying to make it accessible right here. So while there's resources, we want it to actually be achievable. So the parents aren't needing to drive. We can go in and take the kids out of class and meet with them on a weekly basis and actually give them those mental health services. So that's all I'll say for now. Got some more. Sure, a little more as we go.
Thank you, Catherine. Yeah, I love the different ways that you all are approaching caring for the youth. So thank you. So this is a bit of a follow-up, but I wonder if you could describe how you do this work. So in terms of collaborations or partnerships that are present, and then in regard to resources. I know that resources are limited. So we'd love to hear, like, how is this work made possible, and who are you doing it alongside? And Alexis, I wonder if you could start.
Yeah, well, at DOH in general, we do a lot of collaboration and a lot of work with our partners. So that's a priority for us here, and that helps us make sure that what we're doing is going to be relevant to the young people, or to whoever it is that we're working with. It's going to be culturally responsive, and it's going to make sense within the community that it is. I love the idea of model expansion and not replication, because we also recognize that no community is the same and every community will do something different. And young people as a community is also the same. Young people want things to look differently than adults do, and they have different needs. And so a huge chunk of my work is around collaborating with young people. So I do spend a lot of time talking with our youth advisory council, and we have youth volunteers and interns, and to talk to them about youth mental health and different aspects of mental health care to really get a sense of what it is they want to see and how they want to see it and what their concerns and their worries are and what they want adults to do about it. And they're far more thoughtful than I think we give them credit for sometimes. So we talk to people. Our youth advisory council, when they started, our youngest was 13 and our oldest is 22. And so that was about 2 years ago. So it's really a broad spectrum in terms of age. And so we get a sense of what the needs are among younger students and what are the needs among older students. We also collaborate a lot with our sister agencies at the Healthcare Authority and the Office of the Superintendent of Public Instruction, Department of Children, Youth and Families, to also find out, Department of Behavioral Health and Recovery, to find out what they're doing and what they're working on, so we can make sure we're also aligning. So we want to make sure our work is relevant to young people, but also align with what our partners are doing. And then we also, of course, work with our community-based organizations. We worked really closely with the Washington School-Based Health Alliance. We work with other organizations on things like tribal engagement to make sure we're being responsive to that. So the way we do the work is we really try to take what we hear from our partners and what we're hearing from our community and integrate that into our programming. School-based health centers have been around for a really long time, and a lot of work was done in 2020 and 2021 to really get some legislation and funding from the state to fund more of them. And so since that time, since we've received funding, we've been able to expand and support brand new school-based health centers. And we went from having about 60 school-based health centers to almost 80 school-based health centers in just a few years. And so we think that's pretty amazing. And our young people are saying they want to see more school-based health, like I mentioned before. So a lot of our efforts is trying to figure out, like, here's what we're hearing from our young people. Here's, our sister agencies agree that this is working. Like, how can we figure out how to make that work?
Thank you, Alexis. Gina, what about you?
Yeah, I think what's also helpful is the context of how Kids Mental Health Pierce County got started. So our backbone organization is actually Mary Bridge Children's Hospital. And the reason Kids Mental Health Pierce County started was we had a youth that actually came from out of county that had intellectual and developmental needs that was supposed to get some services in the emergency department when there was some behavioral escalation. And this youth that really needs consistency and structure ended up boarding in our emergency department for weeks on end. And so when you've got turning over staff, you've got a loud environment, that's not therapeutic, right? And so it was not a great experience. And so it was hundreds of thousands of dollars of unreimbursed expenses to the hospital. There were staff injuries. And so Mary Bridge Children's Foundation said there's got to be a different way. And back then that was unheard of. Today's world, especially with how behavioral health has become more complex, more prevalent, and just there's a lot that's impacting our kids, this was looked at as a model of how can we bring the community to the table when we can't make more resources appear overnight. I can't address the workforce shortages with social workers and make them appear. I can't change the reimbursement rates for insurance perhaps overnight, but what we can do is we can foster collaboration. And I think that's what Kids Mental Health Pierce County is about. Is we reference the Spider-Man meme all the time where people are pointing about this is Department of Children, Youth and Families services that needs to happen, or this needs to be Developmental Disabilities Administration. At the end of the day, we're all serving the same kids, right? And so when we look at it from what can we do together, that's where I think we make the difference. We really focus on partnerships across silos to enhance access and care coordination and look at local and statewide capacity. So some of the things that we've done is like we've done trainings to every school district within Pierce County, and it's resulted in schools saying we actually need to change our crisis response policy, that instead of a kid saying, I'm thinking about harming myself or I've got suicidal thoughts, instead of bringing them to the emergency department, well, do you know about your crisis provider? And can they come on site instead of re-traumatizing them by bringing them to the hospital. Or perhaps it's being able to just as a community come together and say, we've got a 1/10 of 1% sales tax. How do we all come together to say these are the gaps in our community, because we're all sharing data about what it is that we're seeing, and not be fighting over those resources that are already so few and far between. And so I think those are some of the big pieces. And I talked about our partners that we did this work in tandem with, which is our Healthcare Authority and our Developmental Disabilities Administration friends. The reason DDA was so critical at the expansion of this team that started in 2022 in Pierce and is now across 10 teams statewide as Kids Mental Health Washington was so many of the kids that were ending up boarding in our emergency departments were those with intellectual and or developmental delays, either diagnosed or suspected. So how do we bring them to the table at the beginning of care to have that coordination? And with our friends at the Healthcare Authority, they have a statewide reach. So I loved what Alexis was sharing about how do you learn from your partners. We like to say that there's nuggets of brilliance that I can learn from our Greater Columbia team that maybe Pierce can benefit from, or maybe what Southwest is doing can inform what North Central is doing. Take that, make data out of it, and push it up as recommendations for advocacy through the legislators, through our school boards, whatever the change maker is in that community, and do it with data and collaboration as the driving factors.
Thank you, Gina. And Catherine, what about you?
I'm just enjoying hearing just on a much more, what feels like a more macro lens than what I normally look through. So I'm on a much more micro scale here. So in a one district, 4 schools, we're micro, but we're taking a lot of the same things that you're talking about and putting that to work here in a district and hoping that this can be expanded and things like what you're doing be expanded out. I had mentioned our director of Health and Wellness Services is Tony Barlow. She has a great eye for the whole collaboration, and that's how we're connected with the Department of Health. And so having a grant to supply a peer specialist to our district. She also has us collaborating with CHAZ, which is healthcare. So we don't have a healthcare center here in the schools, but we do have CHAZ comes out from Spokane and sets up a mobile unit at regular times throughout the month so that it's right beside the high school. It's at the wellness center. It's open, and not just to the students in the schools, but then again, we also have an expanded view of community and family members and staff as well. So that serves all of those in addition to students. And then we have a collaboration with a counseling organization, Charmed Counseling, and they supply therapists that work in our district. So we're multi-level support. So our interns who are supervised can do a lot of basic tier 1 level support and work. But when there's kiddos that need more than that, we have our Charmed therapists that we can then refer to. And speaking of accessibility, those tier 1s, there's no insurance involved. This is just covered through the district and through having interns and all of that supervision. So they don't have to go through insurance billing. When it gets to the tier 2 with Charmed, then it becomes a little bit different. But even community members can access that no cost, no insurance healthcare through the wellness center. So collaboration and everybody trying to be on the same pages at the end of the day. Those are the goals.
Yeah, wow, that is, I know, so unique in so many communities to have mental health care that's provided. So it's really sweet to see the work being done across the state. Gina, I wonder if you could start with the next question. There's a lot of discussion about prevention versus treatment. So what are you seeing that young people want more of and need? And what is working for young people in this space?
Yeah, I'd say one of the things that surprised me as a provider is that youth are actually wanting in-person services. I think there was such an explosion of telehealth services and how we do our work as professionals that we kind of figured, and I'm just going to use we as a blanket term, that like as youth get more opportunities to work remote or go to school online, that would be something they're comfortable with. We're actually hearing the opposite, is kids really do want to be in person with providers. So being able to maximize what behavioral health access is going to look like is having just really an a la carte menu of what's available in a community and letting the youth be able to drive that. Sometimes they do want telehealth, sometimes they want in-person services. What I'm definitely hearing about what young people do for sure want and need is, again, they want clinical and non-clinical behavioral health resources. So we've seen things like hip hop therapy, we talked about animal services, wilderness griefs. Sometimes it is going to be intensive inpatient services, sometimes it is going to be cognitive behavioral therapies. It's just really going to take a multitude of opportunities. And then peer support is another huge piece too, is when you're looking at serving a youth, you can't just think about the environment and the family that they're in. You have to be able to take that as a holistic opportunity. And so looking at, like, what does peer support look like for their caregiver? What kind of opportunities do they have for faith-based services? Just really looking at what's important to that youth is just absolutely critical. And then the last thing that I'll share is after school activities. Every time I step into a space, I was just in a high school youth presentation last week at a high school where they did a presentation to us, some county council members, school board members, superintendents about their community leadership class. And they said, we want more after school activities. They want enrichment opportunities. So again, just looking at what wellness looks like holistically is a pretty critical piece for our kids these days.
Thank you, Gina. I love that. I have a friend here who's a therapist, and she's like, winter sports are the best prevention for kids during the winter because it gets them out and moving, and we need to think about things like that in more creative spaces. Catherine, I wonder if you could go next.
Yes. So we started out our program with a lot of responding, so treatment. And then it's expanding more and more. And again, the DOH grant that we have is really focused much more on prevention than just treatment. But it's getting in there, connecting with kids. I think that talking to kids, a lot of what they need and want, and sometimes don't realize, but often do, surprisingly, is just connection. They need connection with adults. They need connection with family at school, both. So family and at school and peers. And it's just that human connection. And that was something that I hear over and over from kids, that they feel like they've lost several years through the whole pandemic and everything being online, and that building those connections is hard. And we've just lost some ground. We do surveys in our district, 10th graders, and just ask a lot of mental health types of questions. And in 2021, so kind of in the midst of that, half of our 10th graders in our district felt that there was no single adult that they felt really connected to or could really talk to. That's huge. And so we are working really hard, some of that kind of data, to just really change that. And so not just from a mental health perspective, but providing then education and support to our teachers and administrative staff so that they are also on the page of supporting not just education, which obviously is highly important, but then the mental health, which really undergirds a lot of that. So that, and then also just groups, giving kids opportunity to be in groups. So, and Gina mentioned like after school programs and all of those kinds of activities. And yes, we have all of that, but also mental health based groups. And then when we do those kinds of things, giving kids the opportunity to give back. So it's about, I do presentations about suicide prevention. It's not just about yourself. It's about then, would you like to be involved? Would you like to be a peer that is actually trained to respond to others, and not on the level of giving them too much responsibility, but also on the level of like, you can take what you've received and what you've learned and pass that on to others. So empowering them to give back as well as to focus on their own mental health and learn to understand all of that.
Thank you, Catherine. Alexis, what about you?
Yeah, I'm glad I went last because it was awesome to hear from both of you, and what you both said is exactly what we've heard from our Youth Advisory Council from 2 different cohorts. So we've had 2 cohorts so far. They've shared they want options. They do want more in-person care, and they want to be able to pick and choose. And so I think that's really important, especially in the tech world that we have, is not assuming that they just want tech options, that they also want in-person options, because it is about having a trusted adult and somebody else that they can actually talk to, that they can trust. They do really talk a lot about peer support, not just like peer support services, which is something we hear of a lot, or like group-based support, like specifically around mental and behavioral health, but also they want to be able to help each other. Almost every single one of our Youth Advisory Council members has said that they joined the Youth Advisory Council so they could help their friends. Like they want to figure out how to make their communities better. They see all of the stuff going on that adults don't see, and they want to know, like, when do I need to like step in? When is it okay? Do I have some tips? Like, can I help them? And so they want their own training. They want to be able to do the work also. And as a social worker, like I recognize that's a really big burden to put on kids, but this is what they want, and they know, like they're really smart. And so and then they, I think they want access to high quality, credible information. And we think of it as, when we think of like prevention at DOH, we do a lot of prevention. Public health is very prevention focused, especially our division. And so we look at it by making sure kids have access to healthcare, making sure healthcare is youth friendly, really promoting well visits, figuring out how providers can do more well visits so those screenings can happen. We do a lot of work to promote universal screenings, like we're funding pilot grants to help with universal screening in school districts and in schools. And so we do a lot of that, but we also know that just making sure that they're getting high quality, accurate, credible information that they can access on their own without an adult is important to them. And so we also do a lot of work to make sure that happens. And then I think ultimately, which I know it's been said before, but I don't think it's important enough. They really want inclusive, safe adults. Like we have like a whole section in a report that we wrote of their recommendations that's all about human support and the types of human support that they want. And so they want adults that they can trust and they can lean on, with trustworthy and helpful and supportive parents, but also without. There are a lot of young people that struggle with parents who just are not supportive for whatever reason.
Yeah, that's such a good reminder. I know we've all heard that it does take a village, but I think the data very much backs that up, that, teenagers are scary sometimes. I think we can all say, and they probably think that about us to some degree too. So it's a good reminder that we stay close to one another. Wow, thank you. I wonder, this is a misconception question. So what do you wish folks knew about mental health treatment in Washington State that can often be misunderstood, or information that you feel like is common knowledge, but maybe isn't? Catherine, would you like to go first?
Well, I'm going to be honest, I kind of struggle with this question. So I'm not sure that I have a strong answer, other than I have heard from a lot of people that it's too hard. It's too hard to get mental health. I don't know who to call. I've tried calling. I don't get through. They don't take my insurance. So I don't know that it's a misconception. I mean, people are tangibly have a difficult time accessing mental health services. And I think this might fall more under the I wish things we could change and make easier. So I'm not completely accurately answering your question, but that's what comes to mind, is just how I hear from a lot of people, kids and adults, that how it's just too hard.
Yeah, thank you for your honesty, Catherine. Alexis, what about you?
I don't know. I think that there's still a lot of bias around being responsive to young people, and that they're being over dramatic, or they're being teenagers, or they're making things up, or I think that they're a lot more thoughtful than we give them credit for. I think they're really tuned in a way that I certainly wasn't as a teenager. And I think that there's a stigma around being responsive to young people and to the concerns that they identify and the needs that they identify, and that for some reason, if adults are just responsive to kids, that there's a disservice being done somewhere, or that it's not really needed. I know we've heard from our partners that young people will request mental health care and will screen positive on different screenings for mental health needs, and caregivers won't believe it. They'll be like, "Oh, we're overdiagnosing," this idea of overdiagnosis, or that there's not really a need. And so I think that I do think that that's something that's misunderstood, is that the data shows that there's a need, and it is really a need. Like, the need is really that high. And I would and that young people are really just expressing the need in a way that we weren't expressing 20 or 30 or 40 years ago. It wasn't that it wasn't there. We just weren't talking about it in the same way.
Thank you, Alexis. And Gina, what about you?
Yeah, I would echo a lot of what Catherine and Alexa shared, including that it really is hard. I am a professional. I've got 10 plus years experience. I think I've got a pretty good network and a decent grasp on how the care continuum works. And I struggle to find providers or understand a definition, keep up with the workforce changes and credentialing. It's a lot. And so I think that's a big piece. I'd also just give a head nod to the insurance access dictates a lot. There's actually less resources available in a lot of spots for commercially insured youth than those that have Medicaid. So it's not just that we have long wait lists and a workforce shortage everywhere. The insurance availability that you have is also a limiting factor in times. And a lot of the private providers that we talk to say they just won't work with insurance companies and they'll only take private pay because billing is too complex, or it's too slow, or reimbursement rates aren't what they need to cover the cost of business because it is business. So I think those are big pieces. I think the other piece that I would also add is that what happens in theory isn't always what happens in practice. So we might have legislation that says you can go these routes, but if we don't have providers to implement it, what's that going to mean? Or in theory, you can have a resource that covers an entire county, but it doesn't actually get out to the rural areas because they just don't have that kind of relationship, or there's not that understanding that there's that need out there. So I think that's a disconnect that can also happen.
Yeah, thank you. So this is a little bit about bias, which I know we've touched on. What do you think, and how do you think bias shows up in youth mental health care? And what have you seen as culturally competent services? And this is, a little bit of the stigma, a little bit of how stigma impacts treatment. And so I know you all work in different spaces throughout the state. And so we could think about that in this answer too. Alexis, would you like to start?
Yeah, I can start. I think all care for young people, care has to be youth friendly to be effective. And I think here in our unit, we think that that needs to focus on a young person's experience and a young person's needs, rather than what caregivers or teachers, or what, rather than what adults may think that they need. And so I think bias shows up when grown-ups think they know more than a young person, a provider. And culturally competent care is what we focus on supporting our providers with, and being responsive to young people, and to letting young adults know that it's okay to be responsive to young people, even if it's not, if we think something different. More We see it as more positive outcomes will come from trusting a young person, to know who they are and to know what they need, and addressing those needs, than taking what they say for granted and moving forward with something based on like evidence-based practice. Or youth-friendly care. So we have the World Health Organization has a definition of youth-friendly care, and I do not know it off the top of my head, that exact definition, but it's based like healthcare for young people needs to be accessible by young people, acceptable by young people, age appropriate and responsive. And so we actually have a youth-friendly care. We're working on a certification where we kind of explain that more, that I'm happy to share. But in our eyes, it needs to be all of those things, but done in a way that young people says makes sense to them. So we look at it as creating a welcoming environment where young people feel welcome in a space, that it's good for them to be there and adults want them to be there. That interpersonal interactions are positive and inclusive and safe and non-judgmental and compassionate. That providers and adults are protecting confidentiality and privacy, and that providers have some very specific types of trainings to make sure that they're, especially when I'm thinking more primary care or family providers or medical providers, but making sure that they're up to date on the mental health care that young people need, is an example.
Yeah. Thank you, Alexis. Gina, what about you with bias and stigma in your line?
Yeah, I think there's a couple of ways that I would add on to what Alexis shared. I think one of them is just following the money, what is paid for and what's not, whether that's what insurance covers and it's talk therapy or it's the lack of funding for after school programs. I think that's a big piece that I've looked at. I also really do believe that like youth want to help their friends. They are showing up for these youth advisory councils. They are engaging in teen mental health first aid. This was a different time and a different hat, but I used to be part of a business association scholarship review committee, and a number of the kids that were actually submitting scholarship applications wanted the money to go to college so they could open up their own private practice for behavioral health, which was absolutely astounding to me. But I think another thing about like what bias and culturally competent services looks like is youth want providers that are representative of who they are and who looks like them. And so for us, I think it's a couple of things that we're really intent on is all of our Kids Mental Health Washington websites across the state really focus on outreach with our BIPOC providers. We want to look at what mental health access looks like for like our deaf and hard of hearing communities. I know that when we host our multidisciplinary team meetings for those really complex cases, maybe it's higher acuity or there's a lot of systems involved, those meetings happen with the youth and or their caregivers, not about them. They need to be centric when they're talking about what care looks like. And then I think another thing is we really want to listen to what do you want services to look like? And that's by having youth be paid to be steering committee representatives. So they're weighing in on those community initiatives being driven at a community-wide level, or engaging with youth by attending school outreach resource fairs. I know Catherine talked about what it means to do like school-based services. And that's a big piece is we as providers should be going where the kids naturally are, whether that's a youth group or a school or a boys and girls club, not making them come to us to be able to provide that input so it's accessible. And we're capturing those voices that don't usually rise to the top.
Love that. Very tangible. Thank you, Gina. And Catherine, what about you?
I mean, I could echo most of what Gina and Alexis just shared, and I don't want to be super redundant, but it's a lot of the same things. It's the kid's voice. It's hearing their voices. I think that the generations now are much more in tune with the needs for mental health, and they're looking for change. They're looking for growth. They want to support their peers. Sometimes caregivers and parents are not on the same page. And so I do see some of that disconnect. Kids are reaching out and wanting to do more in this area, and parents are similar to what Alexis was, I think it was Alexis said, just parents not acknowledging, thinking, oh, they're being dramatic, all of those kinds of things. And so kids are trying, like they want to be better. And so what we need to do and what we're trying to do as the adults in our district is respond to that with the kids, but then we also, like I mentioned a couple of times, offer a lot of community support. We do classes like weekly. We're offering classes to parents to really try to open these doors, open the conversations, encourage parents to be that mental health and other support in their kids' lives, as well as classes, not just to parents and community members, but within the schools to the staff and professionals as well. Just really trying to get the entire community on board with what it means to be culturally responsive to what the kids need and to hear their voices. It's a lot of listening. Like truly, it's a lot of listening. We have, I say all the time, 2 ears, 1 mouth. So more listening than talking, I think, is what I'm seeing adults needing to do with the kids, is hear what they need and try to respond to that.
Yeah, that's such a powerful reminder. Thank you, Catherine. So we have included advocacy in our grant efforts this year. And so I wonder if we could explore the role of advocacy in your work, if there has been impactful policy changes in mental health or in the field that have been helpful. Or what would you like to see in the future? So kind of wondering about advocacy efforts in general. And I think I'll just open this up and not call on you. So if you would like to go first, or who would want to tackle this question first would be great.
I can start. I'd say one of the ones that influences the work that I see across the state from our 10 teams with Developmental Disabilities Administration and Healthcare Authority partners is that youth 13 and older have the ability to seek care without their parents' knowledge or consent. And that is a couple of things. Is one, we talk so much about like we have to listen to youth. So when you've got a 13-year-old that wants to make decisions, that's something that we need to address and show up for. It can also create some complexities as far as like care coordination and services, walking that line between how do we keep a youth safe while we're legally helping them access these resources. That's been something really big. Another piece that I would just point out is there's just a lack of providers for availability of who can serve those under the age of 13. So a lot of times these youth are boarding in emergency departments. So I think that's been a big piece. I know we did a really big data analysis and we had 580 referrals that have come in for multidisciplinary team requests. And the average age for those that are hosted is about 12. And that, again, I think speaks to that. What do we do for that 13 and older population? And how do we address the lack of providers that are 13 and under? And I think another thing that we're looking to do is we can make sure that we're doing education and outreach to universities, peer credentialing programs to say like, hey, are you aware of the resources or provisions, or do you speak in your educational content and I guess it's curriculum about like how do you serve this specific population. So I think there's a lot of big pieces that are coming that 13 and older legislation has really influenced.
I can go. Our at DOH, we do not advocate because of our role as a state agency, but things that have been helpful to our work and to work here at DOH is funding and legislation for things like school-based health centers, which directs the Department of Health to establish a grant program to then distribute funds allocated to us by the legislature for specifically school-based health centers. And we've done some work to request additional funds specifically for behavioral health expansion or improvement in school-based health settings. And so that's allowed us to really get a lot more money into the, like our job really is to get money into the community, to communities who are providing youth-friendly care, and to get it into communities that are historically underserved. So we have a very loose goal that we would love to see school-based health centers in every county throughout the state. We would love to do more to support school-based behavioral health projects like Catherine's projects and some of the things that King County has been doing with school-based behavioral health. And so those are things that I'd like to see. I'd also love to see our Youth Advisory Council or other similar youth groups recommendations for behavioral health implemented. I think the Legislative Youth Advisory Council I know has made recommendations. The DOH Youth Advisory Council has made recommendations, and I will share those with anybody who wants to listen or who's willing to read them. But I really think taking their recommendations and their ideas seriously, there are some, and then the final thing that I would love to say is supporting actually young people's work. There are some amazing young people here in Washington who are doing work on behavioral health and who've created like applications and different programs, and they're like teenagers, they're in high school, and they have some really cool and innovative ideas, and they're really driven and really motivated. And I think adults supporting more of work that's grounded in young people for young people, I think would also make a really big difference.
Again, I'm going last and I'm looking at a more micro view than the bigger view. One of the reasons that I was drawn to work at Medical Lake School District is because of their model and relating to what Gina was mentioning about the legislation that now students 13 and over can self-refer. But if a 13-year-old wants to self-refer for any type of care, they still need to somehow access the medical insurance that is through likely their parent in many cases. With our district, anybody 13 and over doesn't need to access any type of insurance, so it can be truly confidential and they can receive mental health services that way without having to include a parent. Many times we encourage inclusion of a parent if it seems appropriate because it might be therapeutic and a positive thing, and that is their connecting person. But in cases where that's not helpful or could be even harmful, we've got that safety net for them as well.
Thank you, Catherine. So yeah, I love to see these questions in the chat. Keep adding them, or come off of mute in a second after this last question. And we love to hear more from the audience. So our final question for the panelists is an action step question. So what action steps can happen, or do you encourage among the different groups happening here today? I know in our prep call, there was already some like collaboration happening, which is really exciting to see. I love when that happens on a panel, like people becoming friends and working together. But what can the audience do? What do you need support doing? And then we'll move on to some more questions. And I'll open it again.
I'm going to practice some stepping back. So Alexis or Catherine, I'll look to you all to share first.
Yeah, I mean, we are always open to, we certainly do not know everything that's going on in the state, but we have positioned ourselves to be in a place where we want to know what's going on in the state, and we want to know about really cool projects that are really centered on young people and that are working. And so I think, like, I've known about the Kids Mental Health Pierce County for a really long time, but I hadn't known that it was expanding across Washington State. And to me, that's really exciting. And so I was really pleased to hear that. And I'm excited to let all of our school-based health centers know about that resource. So I think if ever there are really cool resources or really cool projects that are going on for young people, we definitely want to know about that. And we're actually really easy to get a hold of. We have like our website, like our email address all over. We have a partner website and our email address is on there. And so we're always looking for collaboration and partnership, or just like, hey, you guys should know about this thing that's going on. And so I think anytime we can make connections and networks, we're always looking forward.
I will say there's so much opportunity with youth mental health. There's so much opportunity. I think schools are a very logical place to work. And obviously that's kind of where I'm coming from. I love the concept of like model expansion, taking similar things. When I first started with Medical Lake, I kept saying every district needs to pattern after this. But every district doesn't need to do exactly what's being done here, because this wouldn't fit exactly in every district, and districts are larger and smaller and rural and urban, but taking some of the ideas that are here and expanding that out. And I think that funding that, promoting that, speaking kind of to some of the things we've talked about today in the communities where you are, in other places, and just spreading the word that there are solutions. There's ways that this work can be done, and not just looking at it and throwing up our hands and saying, oh, it's such a problem. There's not enough mental health. Yes, kids need more mental health. There's actually tangible things that people are doing that can be replicated or expanded upon or taken and then customized to each district. So I think people here listening can take some of these ideas to where you are in the places you are and have hope and pass it along.
Thank you, Catherine.
And I can close us out here. Really just implore the people on this call is to just do an asset inventory. I think to Catherine's point of like, yes, we do need more resources, but also to start looking at who are your partners? Where are the gaps? What stakeholder do you have a relationship with? So kind of invert that Spider-Man meme. So instead of saying it's this organization's responsibility, say, who do I know at that organization? And start learning about what is the scope and the limitations of what they can provide. I think there's a lot of misconceptions about what different services are able to do. I think there's also a lack of knowledge about the great resources that are out there and everything they can provide. So I'd say that's a really critical thing to do. And then I'd say another thing is like if you don't even know where to get started, our shameless plug for our Kids Mental Health Washington website is we talk about the different stakeholders we engage with. So you can start thinking about, okay, who is my contact at a local tribe? Who is a local queer organization that I can connect and refer to? And just start looking at it from like an asset-based opportunity of we can do a lot through collaboration and partnerships.
Thank you, Gina. So yeah, I love these questions in the chat and just keep encouraging folks to add their ideas and questions. But I want to start with Aru's question. Thank you, Aru. Does mental health care for LGBTQ plus youth add an extra bias that needs to be addressed, given that they may not get support from traditional sources like their family or community? And I'll just open it up again to the group.
Yes, it's the short answer. That can be very complex. I mean, obviously, we're wanting to support wherever a youth is at, but if they are not receiving support and do not feel safe in a home environment, then that's something that by being able to access services through school that separates from that home environment, that can begin giving them some of that support. Not sure where else I wanted to go with that. But also some of what we're doing in our district, and I think this is just going to be, it's going to take time. It's taking time for people to shift and grow and learn, but we're providing not just mental health services for youth in those communities, but also groups, so they can have like a support group. And then also we've been offering classes for parents that are willing to admit that they're struggling with this and they would like to be supported. They haven't been very well attended, but we're going to keep doing it. So kind of coming at it from both directions.
Alexis, would you like to go?
Sure.
or-
I totally agree. I think from a data perspective, kids in the LGBTQIA plus community are at a higher risk and have higher rates of almost everything. And I'm happy to share the Healthy Youth Survey data from 2023 really clearly shows that. And so I'm happy to share links to that too. So that sentiment is supported by data. I think for healthcare providers, I think there is a lot of questions to us about navigating exactly what Catherine just talked about is like, how are we navigating when parents aren't supportive, but young people really need help? And how do we navigate, especially confidentiality and privacy for young people? And so some of the work that we're doing is trying to figure that out because it is so complicated and it's so scary to providers and to students that students from the LGBTQIA plus community are not seeking services because they're scared of being outed or of their parents finding out. And then on the other hand, providers, when they do go see, we've learned that a lot of providers are not billing for those services to ensure confidentiality. So then they're not getting paid for those services either. And so there's also situations going on like that.
I would echo everything that Catherine and Alexis would say. I'd also just encourage providers to look at what data is available to them locally, look at your local healthy youth survey, look at what kind of partnerships you're aware of, queer serving agencies, and what that could consist of. I think another thing that we do really concretely, maybe that's something you can take to your own practice, is when we're facilitating meetings with youth for behavioral health navigation or we're convening multidisciplinary team meetings, we will use the youth's preferred pronouns and names. And if there's a slip up because it happens and we're human and things are evolving, or maybe it's new, we're just really big on reiterating like this is what the youth has expressed as their preference, and that's what we're going to go with to support them in this space.
Thank you. I love, yeah, the creative ways that making youth feel welcome. We have another question from Aviva, and I think we'll end after this unless there are more questions from the audience, which we definitely have time. So feel free to keep adding those in. But Aviva, thank you for this. I appreciate the conversation around bias and culturally responsive care and your insights there. To dive a little deeper, from your perspective, how does race and or gender identity intersect with youth mental health?
And I can kick this one off. I think there's a couple of pieces that I thought about when I thought of how I would address this question. I know one of the things that we did is like this is a current conversation where like people want to have it, but they don't really know where to start. So we at Kids Mental Health Pierce County, we had a training about how to talk with kids about race and stigma. And so that's something that we made available for community members and for providers. I think another thing is just it's a reality of the workforce that's available is kids are telling us they want providers that look like them. And when you look at the workforce, that's something to be mindful of when you're making referrals and just realizing the limitations of what's available that can honor that. And then I think the third piece is just we really do want to center how critical that is in accessing care that is culturally appropriate, which is why if you all know of providers and you look at your regional website and you see that there's a great resource that we can champion through a newsletter spotlight or we can list on our resource websites, please send them our way or send it to me directly and I'll drop my info in the chat because we want to promote those things. It's a reality of how people access care, but there's also some systemic structures that also are limiting the ability of care.
Yeah, I think I can't remember who said this before, but I think that young people want their providers to look like them. And so I think that's essential. They've told me, young people have said that it's like essential to building trust and building those relationships. And like they're like, especially when so many behavioral health providers kind of look like me. They're like white women. And so I think that it's really important to support people of color, Indigenous people, LGBTQIA people who want to become behavioral health providers or who want to enter the workforce because that's what young people want to see. And they also want to see younger providers. And so I think figuring out ways to get young people into the work to support each other, I think is really important to that intersection. And I think that would do a lot more or would work with adults who are doing the work and not against us. So I think that like we need everybody and we also need for more people to look like the people that they're serving.
I do not think I have much to add to that. I mean, you guys really covered that. It's the whole levels. It's what we have now, but then expanding out. Again, I really like where I work. So I love that we're bringing in interns. Some of our interns that are counseling at the high school are not that much older than students, and students have voice in that. It's listening to what they want. Some of them want to have somebody that is closer to their age and some don't. So like listening to what their preference is, but we have a broad range. And then education programs, partnering with education programs locally, and we have distance interns that are in distance programs, but just partnering with these different programs so that we can encourage the programs, support the programs, and have greater diversity in our counseling workforce as well.
Thank you, Catherine. And there was a follow-up. I think someone's asking from the chat, can Catherine repeat what she said about a safety net for kids seeking care that can't access insurance?
Yes, I was speaking specifically again to my location. I'm on the micro level here. But what we have is because of the legislation that allows students over 13 to have confidentiality in their health care, and coupling that with the model that we have here at Medical Lake, where students can access care without needing to access any insurance. So we don't bill insurance for our level 1 of care here. So students can simply, if they're 13 or over, can request services through the district, and they can see a counselor on a regular basis. And if they don't want their parent to be informed or have anything, unless there's a safety issue, we will keep that confidential. So that's kind of a safety net. A kid that doesn't feel safe disclosing information at home, we'll keep that confidential. So that's kind of what I meant by the safety net here on with kids not feeling safe sharing specific things at home. If the caveat to that is if they were expressing suicide or homicide, like the big scary harm issues, those things we would still disclose to a parent. But some of the issues that they're wanting to keep quiet, we provide them that confidentiality. I hope that answers the question, what you're asking.
Perfect. Thank you, Catherine. And just want to invite one more time if there's any follow-up questions or any other thoughts from the audience. We'd love to hear, but if not, please join me in, Aru. Yes, I see. Feel free to come off mute.
So I have a question for Alexis. Alexis, you mentioned, what was that? Universal screenings. For what age group and what is the screening being done for?
Yeah, that's a great question. So when we think of when I think of universal screenings, that concept is that all kids, and I'm thinking students in the school setting or kids going in for their well visits, are being screened, at least a primary screen for mental health needs. And then if the screen is positive, that's followed up by either another screen or is followed up by some kind of at least a brief intervention and referral. So we promote universal screenings, this idea that basically like every time a young person goes in to visit their primary care provider, that they're being screened for mental health needs. And a lot of providers do it. It's like a really quick 2-question survey called the PHQ-2. And it just kind of asks basic questions to get a sense of how young people are doing. And some providers use a screener, some providers will integrate it into the conversation. So it's a little bit more like, so how are things going? Any kind of concerns? And so the idea is that if all young people are being screened at some point, that we'll be able to identify mental or behavioral health concerns early and provide support and intervention before it gets to be something really critical or a crisis. And in schools, there are some school programs that are implementing a universal screening across their schools or their school districts. And so we've been supporting a pilot in Walla Walla to try to not replicate, but expand a model that King County has been using to do school-based brief intervention combined with a universal screening. So taking time to screen all the students in the school, in whether it's an elementary school or a middle school or a high school, at a designated point in time of the school year. And it's the same thing with the tiered support. Some of those students aren't going to need anything. They're going to be doing just fine. But a lot of those students are going to need just a little bit of support. And sometimes those are things like getting to the doctor, transportation to the doctor, food, shoes, help with getting after school care or whatever it is. And sometimes intervening then can prevent other things from happening. But it also helps to find those kids who do have major mental health needs, but we have biases where we might not see them. Like it's somebody who's doing really well in school, or it's somebody who has really supportive parents that we might not notice so much. And so by doing a universal screener, it addresses a lot of bias. It makes sure everybody gets attention and care, and then it catches things early. Sorry, I'm like, I wish I had more time to talk about that. It's a project we're supporting to do a pilot, but King County has been doing a lot of work in the school system about that. And if there's more questions about that, I could certainly make a connection to the experts.
Yeah, Catherine, thank you, Alexis. Catherine or Gina, do you have anything to add about screening, general screening to that? And no pressure. Okay. Cecilia, I see that you have a question. Yeah, thank you.
Yeah, thank you all for contributing to this panel, and like I've just learned so much, so I really appreciate your time. Alexis, you mentioned youth to youth programming and innovative things that are happening, and I would love to potentially end on that note.
Oh my gosh. Okay. So we have been contacted by young people because of the Youth Advisory Council to tell us all of the cool stuff that they're doing. And we are not able to take any direct action on it, but I did promise them that I would tell people about what they're doing. And so we started we started a new page called, let me find it here. Is this the one that we want? I'll find it. I have to find the link to it. There are some really cool projects going on that some young people have figured out. There's like one where it's called Nexus. There's a young person who came up with this whole like peer support groups in the community. Yes, Tanvi. Peer support service groups with an application. There's a young person who contacted me and they're like, okay, I have these 2 ideas for these new interventions. How can we make that happen? And I'm like, oh my God, these are really amazing ideas. And so I think something happened to my website. I'll find it. But I've been, okay, here. It's called, what I promised them to do, that because I can't directly respond to them, is I'm just sharing what they're doing on this webpage that we have called Get Involved. We have a Washington Youth in Action. And so when I hear about some of the things that young people are doing, I'm like posting it there because then it makes it easy for me to share.
Awesome, thank you.
Thank you, Alexis and Gina, for adding those resources. Well, I think this is a great place to end, and I hope you can join me in sharing gratitude to our panelists. Thank you all for being here today. What a wonderful panel where we've learned so much and really gained insight into what is going on in youth mental health across Washington. So thank you again. I hope people stay safe and warm out there as the weather is exciting this week, and appreciate you all joining us.
Thanks, everybody.
Thank you.